This man has problems with daily back pain for the last 10 years. MRI showing herniated discs at multiple levels in the lumbar spine. Standing up and slightly leaning forward provokes the pain. Small everyday movements provoke, but he can lift heavily and he practices floorball 4 times a week, an activity that his back tolerates quite well. He has difficulty turning over in bed at night and he's very stiff in the morning. Examination in standing shows that the pain is provoked when he raises his arms. He has difficulty controlling lumbar extension. It's easier for him to lift his arms if he's sitting down, as the back gets into a better neutral position in sitting. Lateral flexion of the trunk is also provocative, revealing sensitivity to rotational forces. If he is allowed to lean against a wall and then lateral flex, the pain subsides. In supine, we notice increased stiffness in the tensor fasciae latae. He fails to keep his back in a neutral position while straightening the legs. The amount of the stiffness in the tensor muscle is demonstrated stabilizing his pelvis while he straightens the leg. As you can see, his infrasternal angle is wider than 90 degrees, suggesting that he does not have sufficient strength in his oblique muscles. The obliques play a very important role in controlling anterior pelvic tilt, extension and rotation of the spine. In this case, the stiffness in the tensor muscle is maintained because of the weakness in the oblique muscles. He is therefore instructed how to control the neutral position of his back by recruiting his oblique muscles. We start in supine with the focus on being able to move the legs with full control of the back and pelvis. He also receives coaching on how to turn around in bed with the cue arm before legs to maintain a more neutral position of the lumbar spine. And finally, he also gets to recruit the oblique muscles while standing with his back against the wall. After working with these exercises for about 3 to 4 weeks, the recruitment of the oblique muscles will start to become automatic, and the uncontrolled extension of the lumbar spine will decrease. After recruiting the oblique muscles, he immediately feels less pain in his lower back with shoulder flexion and side bending.